When COPD symptoms change, it can be hard to know what's normal and what's urgent. That's exactly why a COPD action plan matters. For many people with COPD, some shortness of breath, coughing, or mucus may already be part of daily life. So when symptoms start to shift, it can be confusing. Is this just a bad day or the start of a flare-up? Should you rest, call your doctor, or go to the emergency room? Caregivers often feel that same uncertainty, and that stress can delay help when time really matters. A good COPD action plan gives you a simple, personalized roadmap for those moments. It helps you recognize your usual baseline, spot warning signs early, and know what to do if symptoms become severe. It also helps you and your caregiver respond in a calmer, more organized way. So in this video, we'll walk through what a COPD action plan is, how the green, yellow, and red zones work, and when it's time to get medical help right away. So let's start with the basic idea. A COPD action plan is a written guide you make with your clinician. It's built around your usual COPD symptoms, not someone else's. Most plans use 3 zones: green, yellow, and red. The green zone means you're at your usual baseline. Baseline means your normal day-to-day pattern, even if you still have some cough, mucus, or breathlessness. The yellow zone means symptoms are getting worse than usual. That might mean more shortness of breath, more coughing, changes in mucus, lower energy, or needing rescue medicine more often. The red zone means possible emergency symptoms, where you may need urgent help right away. Think of the plan like a traffic light for symptom changes. Green means stay on course, yellow means pay attention and follow your clinician's written steps, and red means stop and get emergency help. Here's the important recap. The whole point of a COPD action plan is not to guess. It's to compare today's symptoms with your usual baseline and follow a plan that's been personalized for you. Now, here's where it gets important. The key difference in a COPD action plan is not just the symptom itself. It's the pattern and how it compares with your usual baseline. For example, some people live with daily cough or daily mucus. That alone does not always mean a flare-up. But if your cough is clearly worse, your mucus changes color or amount, your breathing gets harder during normal activities, or you need rescue treatment more often, that may fit the yellow zone. That matters because yellow zone changes can be early warning signs that your COPD is worsening. In contrast, the red zone is about more severe danger signs. Severe shortness of breath at rest, chest pain, confusion, blue or gray lips or fingernails, coughing blood, or extreme drowsiness are not symptoms to watch and wait on. What this usually means is that you need emergency care. So the practical way to read the plan is simple. Green is your usual pattern, yellow is a clear change from usual, and red is a possible emergency. That's the framework that helps patients and caregivers act faster and with more confidence. So what can you actually do about it? First, work with your clinician to create or update your COPD action plan so it clearly spells out your green, yellow, and red zones. If your doctor has written instructions for inhalers, nebulized medicine, oxygen, steroids, or antibiotics, make sure those steps are easy to read and current. Second, keep the plan where you and a caregiver can find it quickly, like near your medicines, on the fridge, and on your phone. Third, review it together every so often, especially after a flare-up, hospital visit, or medication change. Now, let's talk safety. Seek prompt medical care if you're in the yellow zone and symptoms are not improving, or if you're unsure what to do. Call 911 or get emergency help right away for red zone symptoms, like severe breathing trouble at rest, chest pain, confusion, blue or gray lips, coughing blood, or extreme sleepiness. This is general information and not a substitute for medical advice from your own clinician. If this helped, consider sharing it with a caregiver or bringing these questions to your next COPD visit.